Hi, I'm Dr. Erin Hunt-Carter. I'm a clinical psychologist at Great Lakes Mental Health. Today, I want to talk about a question I hear all the time. What's the difference between anxiety and an anxiety disorder? Clients often tell me that they don't want to feel anxious at all. I get it. But anxiety itself is not a problem. It's a normal human emotion. Anxiety is your brain's built-in alarm system. It evolved to keep you safe. We are the descendants of the ancestors who were a little more observant, a little more vigilant, and a lot more anxious. Unfortunately, our bodies aren't really good at telling the difference between the threat of being rejected by a love interest and the threat of something like a hungry crocodile. Both situations activate our sympathetic nervous system, which triggers the fight or flight response. Anxiety gets our body prepared to act fast to stay safe. Moderate anxiety is also beneficial because it improves our performance. It helps us lock in, it sharpens our attention, and increases motivation. If you had no anxiety at all, it would be hard to motivate yourself to do many of the things that you need to do every day. If I weren't a little anxious about getting sick, I might not bother washing my hands. If I weren't a little worried about money, I might decide to sleep all morning instead of going to work. It turns out that most of us actually have an optimal level of anxiety where we operate best. Too little anxiety, and we don't get much done because our arousal is too low. Too much anxiety, and we're overwhelmed and frozen. A nice moderate level of anxiety keeps us motivated and unstuck. So we don't want to get rid of anxiety entirely. But when does it become a disorder? Well, there are three things I ask clients about when trying to determine whether they have an anxiety disorder. First, I look at intensity. Normal anxiety fits the situation. It's proportional. So when someone has an anxiety disorder, their anxiety is consistently bigger than the circumstance calls for. So let's say we use a rating system of 0 to 10, where 0 is no anxiety at all and 10 is the most anxious you've ever been. Now, let's say someone is experiencing ordinary stressors like giving a presentation, taking a sick pet to the vet, or traveling to an unfamiliar city. These types of things are probably around a 4 for most people. But if someone is telling me their anxiety is consistently a 9 or a 10 in these situations, I'm going to start to wonder if they might have an anxiety disorder. But intensity alone is not enough. I also ask about how long the anxiety lasts. Typical anxiety rises and falls like a wave. But with an anxiety disorder, the worry or fear tends to stick around. It doesn't fade like ordinary anxiety, or it fades temporarily and then pops up over and over again when it's not needed. So, in addition to intensity and duration, I always evaluate impairment. This is probably the most important piece. An anxiety disorder interferes with your life. You might avoid situations you need or want to be in. You might struggle to sleep, concentrate, or make decisions. Your world may start to shrink. The anxiety stops being a helpful safety mechanism and it starts running your life. Normal anxiety is kind of like a smoke alarm that goes off when there's a real fire. It's helpful and protective. An anxiety disorder is like a smoke alarm that goes off when you make toast or use hairspray or just look at it funny. The system is overly sensitive. It's trying to protect you, but it's firing too often and too loudly. If this sounds like you, it might be helpful to talk to a mental health professional like a psychologist. They can help you figure out if you do have an anxiety disorder, like generalized anxiety disorder, social phobia, or panic disorder. And if you do, the good news is that anxiety disorders are highly treatable. Evidence-based therapies like cognitive behavioral therapy, exposure therapy, and acceptance and commitment therapy can make a real difference in your daily life. We can help you recalibrate that smoke alarm so that it's not going off all the time, controlling your life and making you miserable. One of the things I love the most about working with clients with anxiety disorders is seeing how their lives transform when they're no longer carrying around the burden of all of that extra anxiety. You just don't realize how much anxiety has taken from you until you start to feel better again. And people do get better. If this was helpful, please feel free to share it. And if you'd like more videos breaking down mental health topics in practical, science-based ways, subscribe or follow along. Thanks for being here.